Well, good morning, everyone. And once again, welcome to another live this morning. A little bit different time for you. Appreciate your patience and appreciate your participation. I know this is bright and early, especially if you're on the West Coast. It's always bright and early. This would be maybe not so bright and earlier. Okay, so let's say hello to a few folks before we get going. Manette, good morning. I hope you guys get your notifications. Eric and Anna, good morning. And Rain from Michigan. Karen, Kincarden, good morning. And Kathy from Simcoe. And Mary from Norwich, good morning to you. Nativity, how are you? Janice, Brampton. And Sandy, good morning. Nick from our staff, good morning. Nick. Keith from Bell River, good morning. Nicole from Sudbury. Sudbury, where's that? Kristen, good morning. Laurie, good morning. Niagara Falls. Deb from Timmins. Sherry, Mississauga. And Francis, good morning. Let's see if anybody's awake on the West Coast. Crystal, how are you? And who was that? Janice? Bev, Saskatchewan. Evelyn, good morning. And Linda. And Linda's listening, she says, from Chatham. See, it goes up into the clouds. I can't see it. Madalena, Laval. Jerry, my friend from Nouveau-Brunswick. I can't see it up there. Let me just see if I get this away. Sophia, Donna, Bell Valley. And Sandy, I can see that. And Norma. And Janice, good morning to you. And Janine, Louisiana. Donna, Newfoundland. Chantal, Ottawa. And Kathy, good morning to you. And Donna from Park Hill. Sandy from the West Coast. There you go. Nancy, how are you? A little bit early, guys. Sorry. Cheryl from West Virginia. Andrea, Nouveau-Brunswick. Edith. Yvonne, Petawawa. Diane, good morning. And two Dianes in a row. And Diane from Earlton. And Donna, we appreciate you guys coming on. Who did I miss? Somebody. Couldn't see it. Well, it goes up. Doesn't always come down. Rita and Anne and Rafaela from Romania. Annette, good morning. And Wanda from Virginia, good morning. Okay, I better stop because I can't see. And that's my background there. Okay, guys. Okay, let's get going. A couple of things I want to bring up this morning. And here they are. If you haven't got our email, get our email this morning because it is so wonderful teaching on the homocysteine and heart disease. Okay? And there's a study there, and I think I'll wait till another time to really break that study down because I sort of put it in the background. And it really is an important study, okay? It's a 6-year study, and anyways, it's described in a fair amount of detail in our email this morning. So if you don't get our emails, go to martinclinic.com and sign up for our emails. You want to get that in your email box. Now, maybe you're getting it or you haven't seen it, and maybe it's in your spam or whatever. Look, what do I know? I know nothing, okay? I mean, if I didn't help people around helping me, I wouldn't know how to do anything on my phone or whatever. But anywho, we're there to help. So if you're having trouble getting our emails, just reach out to our staff at martinclinic.com or on our private Facebook group. I know most of you have joined that. And we send out emails, and in the emails, we go into a fair amount of detail. Now, one thing we were looking at is heart disease. I talked about it yesterday number one killer. We haven't even made a dent in heart disease. Isn't that crazy? After all the years. Of course, we were looking at cholesterol rather than the real cause of heart disease. Okay? And cholesterol became, I love the way Tony Jr. Calls it. I call it the cholesterol scam. Tony Jr. likes the cholesterol cult. Like it's a cult-like following. And, you know, by and large, and guys, look, I don't mean to be negative, okay? Sometimes you bring the news and it's negative, okay? In a sense that I'm not optimistic that anything's going to change much. So my goal is teaching. I'm giving you another view of it, okay? I'm giving you the alternative to it, the alternative to cholesterol. And, you know, I'm sure if I had 100 physicians in the room, 99 would disagree with me because their teaching is cholesterol is the major cause of heart disease. And what the email was about this morning is B12 and a thing called homocysteine. That is a test that should be done. I like it. It's a test because homocysteine is a factor in heart disease. So is inflammation. You get a CRP test done. Inflammation. You know how we always say it. It's not Houdini. Inflammation has to be caused by something. And the biggest cause of inflammation and the biggest cause of a lack of a high homocysteine. Homocysteine, by the way, inflammation is like a fire. And homocysteine is like smoke damage of the fire. Okay? So when they do your homocysteine levels, if they're elevated, you got smoke damage in the house. Not in your house, but in your body's house. And I don't know if any of you ever have experienced this, or you know people that have gone through smoke damage, where there wasn't that much of fire damage, but there was a huge amount of smoke damage. We've heard that, right? In the news. Lots of smoke damage. And then months and months of, people coming into the house and tearing things apart and rebuilding, regenerating the home because of smoke damage. That's what homocysteine is, okay? And what we were explaining is, with inflammation, okay? Now, again, let's just really quick. Inflammation. We all know what that is. You ever had pain? You got pain? Anywhere? That's inflammation. You don't get pain without inflammation. If you kick me in the knee, that's normal. Your body's ambulance system comes, it repairs. If you have a cold, you're going to have pain, headache, sinuses, sore throat. What is that? Inflammation, your body's ambulance system. It's your lymphocytes go up, you've got more white blood cells, you've got more protein, you've got more blood supply, and it ain't no fun, but it's there to repair until inflammation is there to repair. I like that. Until it's left unattended, until it doesn't go away. When inflammation becomes chronic, and a lot of times it can be silent, meaning you don't even have any more pain. It's on the inside, but it damages, number one place that it damages is blood vessels. Okay? The endothelial level, the Teflon lining of your blood vessels, that's the first place that gets damaged with inflammation when inflammation is chronic, when it stays, when it doesn't go away, when it's caused, number one cause, by the way, the number one cause of silent inflammation, silent, in a lot of times, no symptoms, is insulin resistance. That's why we talk about food all the time. Insulin is a food hormone. And you really only need insulin when you're eating sugar and crappy carbohydrates. That creates an inflammatory response over a period of time, especially when your cells say, hey, you, out, I'm tired of you, I hate you, insulin, quit coming to my house. That's your cells talking. But insulin's got a job to do, whether you like it or not. And if you eat carbohydrates, if you eat especially the crappy carbs, bread, pasta, rice, cereal, sugars, sweets, whatever, juices, milk without the fat in it, you're going to find out that your insulin, it's got a job to do. It's got to take sugar out of the bloodstream. It will come knocking at the cell wall and say, open up. I don't care if you don't like me. Well, you know what happens inside your body? Your body responds to that action at the cellular level by creating an inflammation response. Okay? So you can have an infection. You can have an injury, you can have, those are on the other side, but one of them is silent, mostly, and that is when people are carboholics. And one way to measure, okay, because I want you guys to understand this, when I send you back your results of your blood work and I say you have insulin resistance, it's because, and I'm anything over 5.4. 5.4 is the marker on your A1C. Anything over it, you know what happens? You know what happens? You have insulin resistance. And that, my friend, is the start, because that creates inflammation, that damages blood vessels, and that damages cells, and it damages your body, and those are one of the biggest reasons for heart disease. Now the other one is smoke damage, and that is homocysteine. And when you have elevated levels of homocysteine, you also have another problem. Houston, you got a problem. You know what it is? It's low B12. You have low levels of homocysteine, you got low B12. If you got high levels of homocysteine, excuse me, okay, you have low B12. It's directly proportional. This is why, guys, okay, this is why it's so important to get your B12 levels checked. 90% of the population or more are low in B12. And unfortunately, even here we are in 2023, and doctors don't talk about vitamin B12. They should. It's one vitamin that they do teach in medical school for about 5 minutes. It used to be very important. I remember in my dad's days, doctors would, remember doctors' bags? You know, I don't know if you ever, I don't see them anymore. Okay? You remember doctors' bags? They used to have B12 shots. You're tired? What? Let me give you a B12 shot. Okay? Rosie, my wife, is a nurse. You know how many thousands of B12 shots she gave out? Okay? Thousands of them. But today, But the connection between homocysteine and B12 is really important. So send me your homocysteine if you have it. Good luck. Most doctors don't even test it. But at least get your B12 levels checked. And if you're not above 800, if that number is not above 800, you have low levels of B12. And your elevation, you will most likely have high homocysteine. You got smoke damage occurring in your house, in your body's house. You like that illustration? Do you? I like it. My head works on illustrations. Okay? Can't you tell? Don't feed the bears. My hat. You know what I'm saying? I'm an illustrator. It's the way I learn. So you've got fire damage. That's inflammation. How do you check that? CRP. I remember this is back in the year, I think it was 2000. So 23 years ago. I did a whole radio show on C-reactive protein. That 7 years ahead of time, at the time there was a study out. I remember it like it was yesterday. There was a study out that showed if your C-reactive protein, which is what? An inflammation test, which is what? Fire damage. Oh, I like this. I'm getting excited. I like these illustrations. Fire damage, you could tell, according to this research study, that by taking your C-reactive protein, CRP, if it was high, and anything above 0 for C-reactive protein is high, okay? If it was high, you were much more likely to have a heart attack than with people who had no inflammation and their CRP was completely normal. How do you like that, my friend? How do you like that? So, what I'm saying to you is, it's important to get these numbers checked. Homocysteine, if it's high, your B12 is low. And B12, guys, look at today. Look at the world we live in. The insanity of people who say that red meat is bad for you. I can't stand it. It's not true. It's insanity when they tell you that you shouldn't eat too much red meat. Where do you get B12? I'm waiting. Where do you get B12? In food. Meat. Not chicken even. Red meat. Red meat. And you guys know that. Sun, steak, and steel. Why did I say that? And you can use ground beef too. Okay? Without the bun. Leave the bun alone and eat the meat. And the red meat. Oh! And here we are. Heart disease is worse than ever. Worse than ever. Because they're looking at cholesterol. Don't eat too much red meat. Do you know there's cholesterol in red meat? You want, and get the lean one. You know, eat, okay, we'll allow you to have some chicken, but you can't have any steak. Are you kidding me? And of course, you got to go mortgage your house to get it. The world is so upside down when it comes to health, it's almost like they want us to be sick. Oh, I've told you this story before, but I'm going to tell you it again. A physician who was a patient of mine. Okay? So, was she smart? She was more than smart. You know why? She came to see me as a patient. And she was really, really teachable. And I taught her Nutrition 101. Okay? But about a week or two later, I don't remember, one of her patients and one of my patients, she did blood work, and they had a high B12. And I give this doctor credit because she called me at the office. She said, Dr. Martin, Susie, that wasn't her name, but let's say it is. Susie's got high B12. What do I do? And I started laughing. And I said, what's the number? And it wasn't high at all. I said, Doc, welcome to my world. That's low B12. And I said, remember a couple of things. B12 is a water-soluble vitamin, number one. You ain't getting sick on high B12. And number two, B12, it's actually lower than I like. Oh, she said. I said, listen, B12 is so important. Okay? Is so important. Get the memo. B12 will help your heart. B12, it's not just, people think of B12, well, energy. Yes, it's good for energy, for sure. Because B12 helps you to have more oxygen. One of the things that happens when you're low in B12, one of the things, could be different things, but this is one sign. You're yawning all the time. Yawning. Your body it's a reflex. Your body is saying, would you, hey, you, stupid. Does your body talk to you like that? Insult you? Hey, you, dummy. Would you get me some B12? But we don't listen because B12. Well, I take a B supplement, a B vitamins. Yeah, no. Oh, do you ever hear me talking about a B complex? What are you taking a B complex for? Eat steak. But B12 is a very, very, very finicky vitamin, and you need it. And your body will give you clues even without blood work. Yawning, numbness and tingling, often low B12. Any kind of funny feeling in the mouth, a smooth tongue, even fluttering. Sometimes people think, well, maybe I got AFib, check it out. But I'm telling you, a lot of times, it's low levels of B12. Okay? So it's really important to, to get that, because a lot of people don't realize, if you're cold, that could be your thyroid, but your thyroid, it's got a lot of strings attached. And you know what, guys? Here's really important about about your body. You're cold all the time. Your B12 is probably low. It's not optimized. And B12 needs to be optimized so that you don't have any smoke damage in your... Guys, I love it. I'm more excited about these illustrations. Okay? You know another one? when you're in the bowel, you know what often a sign of low B12 is? This is just my years of experience, okay? And it rarely happened in men, mostly in women. Constipation. Dr. Martin, I'm constipated. Well, either you're not drinking enough water, either you're not drinking enough coffee, or your B12 is low. It had nothing to do with fiber. Fiber is, I can't stand it. What a lie that is. Fiber, fiber, fiber. Brought to you by the cereal companies. They made fiber famous. And they were lying to us. But a sign oftentimes is in low B12, not enough water. The best fiber in the world is coffee, and low levels of B12. There you go. Okay, guys, I gotta fly. Little shortened version today. We'll, I just had fun. I worked out. Okay. We love you guys so much. Okay? Tell your friends. Spread the word. Get the other side. Get the alternative on health. Tune in to the Doctor Is In podcast. Love you guys. Talk to you soon.